we're kind of working backwards now with the lower extremity because I want to start by comparing the hand and the foot. So these things make up about 56 bones. Just the phalanges here that we see are 56 bones of our appendicular skeleton. But they're all named the same way, so that takes care of 56 bones. So, just like we had in the hand, we're going to have a distal, a middle, and a proximal phalanx in the foot. So they do look a little different. Let's turn them to the side for comparison. So we have a really tiny distal phalanx, middle phalanx, and then a longer proximal phalanx. You do need to specify the digit. So again, the big toe, or digit number 1, only has 2 phalanges, so it'll have a distal and a proximal. But these other guys, 2, 3, 4, 5, they're all going to have 3 phalanges. So on a lab exam, you need to tell me what digit is it and which phalange it is. And that'll get you full credit. We still have our metatarsals in this case. So 1 is huge. This is bearing a lot of weight. 2, 3, 4, 5 are a little smaller, but they're just as important for forming our arches. These also have heads, shafts, and bases, but again, don't worry about that. Just focus on naming and being specific with which metatarsal it is. So let's move that hand out of the way. This is where the foot starts to get funky. So we have tarsals to talk about. Which view we can look at is debatable. So I usually start people, I put it on this view just for comparison with the hand, but it's probably going to be most helpful if we talk about this from anatomical position. So, there we go. So this is going to be anatomical position. We can see based on how the bones have been articulated, we actually do have our arches here, a longitudinal arch and then a couple transverse arches. So let's just set it up so it's not going to fall on us. Right now we are looking at a superior view of the foot. And this is how your lab manual does it. So we'll start with the superior view and then I'll give you a lateral view, or rather a medial view. So we have laterally the cuboid. It's going to be this really prominent bone here. And then we have a series of 3. 1, 2, 3. These are called our cuneiforms. So laterally, most laterally, we're going to have our lateral cuneiform. This is our middle cuneiform, and then we have our medial cuneiform. So medial lines up really well with digit 1. Intermediate or middle lines up really well with digit 2. And then our lateral cuneiform lines up with digit 3. So you can use these to help orient yourself. So it'll go 3 cuneiforms, and then cuboid is lateral. That's kind of our first row of tarsals. So our second row of tarsals now, we have the navicular. This is the longest of the tarsals. So far the ones we've been talking about have been pretty squat, pretty cube shaped. This one breaks that formula. So it's longer and it curves around this next bone here. Okay, so that is navicular. We have 2 more tarsals. So this guy up top, this is our talus. And it's really smooth. This is an articular surface here that's actually going to articulate with the tibia. So this is our talus. And then lastly we have our calcaneus, and this is going to be that biggest of the tarsals. Calcaneus, if we flip this over and look at a posterior view, you can see just how large this guy is. So it's all of this. Sometimes we call it the heel bone because it's forming our heel. And then lastly, if we look at it from a lateral view now, so this is digit 5, this is our talus up top, this is our cuboid laterally, this is still calcaneus, the heel bone. And that is it for the foot.